How to access rare muscular dystrophy blood marker tests. If you or a loved one are facing muscle weakness and suspect muscular dystrophy, you might wonder how to find those rare blood tests that can give more clues about the specific type. Accessing these tests involves a careful process guided by healthcare professionals who specialize in neurology or genetics. The first step usually starts with a thorough medical history and physical exam. Your doctor will look for patterns of muscle weakness and may order initial blood tests, like measuring creatine kinase levels. Elevated levels of this enzyme indicate muscle damage but don't tell you exactly which muscular dystrophy is involved. Next, genetic testing becomes the main tool for diagnosing rare forms. Your doctor will likely recommend blood tests that analyze your DNA for mutations in specific genes linked to muscular dystrophy. Sometimes, these tests can be done with a simple blood sample, but in certain cases, a cheek swab, skin biopsy, or muscle tissue sample might be needed. These genetic tests are highly precise and can confirm the exact type of muscular dystrophy, helping with prognosis and treatment options. They also identify candidates for clinical trials that target specific genetic mutations. If genetic testing doesn't give a clear answer, a muscle biopsy might be performed. This involves surgically removing a small piece of muscle tissue to analyze the muscle fibers and proteins like dystrophin, which is missing or reduced in Duchenne and Becker muscular dystrophy. Techniques such as Western blot and immunohistochemistry help determine protein levels and muscle tissue characteristics, providing additional clues to the diagnosis. To access these tests, it's essential to work with a neurologist or a neuromuscular specialist. They can refer you to specialized laboratories or clinics that offer panels for muscular dystrophy genes. Some tests may require prior approval from your insurance or a referral to an academic medical center. Participating in clinical trials can also be an option, as they often provide access to advanced testing methods not widely available. Reaching out to reputable diagnostic labs or organizations dedicated to neuromuscular disorders can help guide you through the process. Keep in mind that these rare blood marker tests are not routine and usually involve a team of specialists. The results should always be interpreted alongside your clinical findings and family history. Genetic counseling is highly recommended before and after testing to understand the implications for you and your family members. While research is ongoing and new tests may become available, current standards follow established medical guidelines. In summary, accessing rare muscular dystrophy blood marker tests involves starting with a specialist consultation, undergoing enzyme testing, and progressing to genetic analysis or muscle biopsy if needed. Coordinating with healthcare providers and specialized laboratories ensures accurate testing and proper interpretation, helping you understand your condition better and plan the right course of action. Always remember to seek personalized medical advice from qualified professionals to navigate this complex process safely and effectively.